It's summer here in New Zealand, and it's when I always talk about vitamin D or vitamin D, depending on what part of the world you come from. There is so much emphasis these days on heavyweight training and high protein diets. However, if your vitamin D levels aren't optimal, then it can be problematic for you putting on muscle, restoring your energy, and if you haven't got enough vitamin D, then that can impact your calcium uptake in the muscles and the nerves. Calcium is an important neurotransmitter. That means it helps in the transmission of the nerve into the muscle for muscle contraction, and if your vitamin D levels are low, then that can be really problematic for you. So one of the things that I recommend as part of the My Menopause Transformation programs, and for women who follow my programs, who undertake my programs, is that if you're going to embark on a lot of weight training, or you want to do a lot more exercise now that you're in midlife, and perhaps you've got time to do this, then please get your vitamin D levels checked. If you are overweight or obese, then vitamin D is it's carried by fat, and it gets stored in fat cells. So if you are overweight or obese, then vitamin D can be a little bit problematic because you're storing it in your fat cells and it's not available for the muscles and for the nerve contractions. So that can be an issue with your sore legs, restless legs, and also anxiety, and if you're not sleeping. So all of these things are connected, and we're not making that connection between what's going on around the body as you move through menopause and into post-menopause. Everybody's looking at solutions in isolation of each other. So don't embark on heavyweight training and a high protein diet if your vitamin D levels aren't optimal. And this is, really not getting talked about in terms of, the health of midlife women. There's a lot of emphasis away from vitamin D, away from having it tested, but I do encourage you to work with your practitioner to get this checked. I know myself that my vitamin D was very low, and I didn't know this. My doctor at the time did not test my vitamin D, and I was doing a lot of exercise and I was spiraling down into fibromyalgia. So you must try and really focus on your vitamin D, particularly those of you who are in your winter months and you haven't got the benefit of some exposure to sunshine at the moment. Yes, you can go on supplements, and that is another way to get your vitamin D. Yes, you can have foods, fatty fish, and other foods that are high in vitamin D, even a little bit of butter. But what you can do is you can also first and foremost get your vitamin D levels checked. So important for calcium uptake in your gut. If you've got gut health problems, you may not be absorbing vitamin D. You may not be getting the benefits of the calcium absorption. So if you've got restless legs, if you've got sore joints, if you've got, if you've got muscles that are feeling weak and you don't have any energy, then this is the one vitamin that I really emphasize in my programs. I'm Dr Wendy Sweet from My Menopause Transformation. My January weight loss sale is on at the moment. It's the best deal ever. Come and join me if you can. Jump on the website and have a look at all the programs, especially my new Beyond Menopause program, which has this fabulous module on bone health and muscle health as well. And yes, I mentioned vitamin D.